Alexandria Ocasio-Cortez's question froze Secretary Kennedy in his tracks. Why is $25 billion in taxpayer money going to companies like United Healthcare that have committed fraud? With that moment, America's biggest Medicare fraud scandal began to unfold, and Kennedy's inability to answer that question would shake millions of Americans' faith in the healthcare system. The House Oversight Committee hearing on Medicare budget allocations had started like dozens of others that Secretary Kennedy had navigated during his tenure as Deputy Secretary of Health and Human Services. The ornate committee room in the Rayburn House Office Building buzzed with the familiar rhythm of congressional oversight. Prepared statements, predictable questions, and carefully rehearsed answers that revealed little while appearing cooperative. Kennedy, a career bureaucrat with 30 years of experience in healthcare administration, had weathered countless congressional hearings. At 56, he possessed the institutional knowledge and political acumen that made him valuable to multiple administrations. His silver hair and measured demeanor projected competence and reliability, qualities that had helped him survive changes in political leadership. The hearing's stated purpose was routine, reviewing proposed increases in Medicare Advantage payments for the upcoming fiscal year. Medicare Advantage, the privatized alternative to traditional Medicare, had grown into a $400 billion program serving over 28 million Americans. Most committee members viewed it as a technical budget discussion, one that would generate minimal public interest or media coverage. Alexandria Ocasio-Cortez had different plans. For weeks, her staff had been investigating reports of systematic fraud within Medicare Advantage plans, particularly those operated by major insurance corporations. What they discovered was a pattern of deliberate overpayments and manipulated risk scores that was draining billions from taxpayers while enriching private companies. The investigation began when Maria Gonzalez, a Medicare beneficiary from AOC's district, contacted her office about suspicious billing practices. Gonzalez had received explanation of benefit statements showing medical services she never received and diagnoses that didn't match her actual health conditions. Her case prompted AOC's team to examine broader patterns in Medicare Advantage billing. Working with health policy analyst Dr. Patricia Williams, AOC's staff uncovered evidence suggesting widespread manipulation of risk adjustment scores, the formula used to determine how much the government pays private insurers for each Medicare beneficiary. By inflating patient risk scores through questionable diagnoses and unnecessary procedures, insurance companies could increase their payments substantially. The numbers were staggering. According to internal documents obtained through Freedom of Information Act requests, Medicare Advantage plans were receiving payments approximately 15% to 20% higher than what traditional Medicare would have cost for the same patients. This overpayment structure was generating billions in excess profits for private insurance companies while increasing costs for taxpayers. Most troubling was evidence suggesting that federal officials were aware of these practices but had taken minimal action to address them. Inspector General reports dating back 3 years had identified significant payment inaccuracies in Medicare Advantage plans, yet the Centers for Medicare and Medicaid Services had implemented only modest reforms that failed to address the core problems. Kennedy entered the hearing room that morning expecting routine questions about administrative efficiency and patient outcomes. He carried prepared talking points about the benefits of Medicare Advantage, increased choice for beneficiaries, innovative care management programs, and cost savings compared to traditional fee-for-service Medicare. These talking points had served him well in previous hearings. Committee Chairman Robert Bradley called the hearing to order, his opening remarks emphasizing the importance of Medicare Advantage while noting the committee's responsibility to ensure proper stewardship of taxpayer funds. Ranking Member Sarah Collins used her statement to highlight the program's achievements, citing statistics about expanded benefits and high patient satisfaction scores. The early questioning followed predictable patterns. Collins asked friendly questions about program achievements, allowing Kennedy to recite prepared talking points about Medicare Advantage's success stories. Democratic committee members followed with routine inquiries about access issues and quality metrics that Kennedy handled competently. Then came AOC's turn. She had been allocated 5 minutes for questioning, standard for junior committee members. Unlike her colleagues, she dispensed with opening pleasantries and dove immediately into substantive issues that Kennedy hadn't anticipated. Secretary Kennedy, I want to discuss the proposed 5.06% increase in Medicare Advantage payments for next year, AOC began, consulting the documents spread before her. This increase will direct approximately $25 billion in additional taxpayer funds to private insurance companies. Can you explain the justification for this substantial increase? Kennedy shifted slightly in his witness chair, recognizing that AOC's question was more specific than others he had fielded. Congresswoman, the payment updates reflect actuarial analysis of medical cost trends and ensure that beneficiaries continue to have access to high-quality care through Medicare Advantage plans. AOC leaned forward, her voice gaining intensity. Secretary Kennedy, are you aware that the Department of Justice has been investigating United Healthcare for potential fraud related to risk adjustment scores in their Medicare Advantage plans? The question landed like a thunderbolt. Kennedy's composed expression faltered momentarily as he processed the implications of AOC's inquiry. The hearing room, which had been filled with the low murmur of side conversations and staff movement, fell silent as observers recognized the significance of the moment. Congresswoman, I cannot comment on ongoing investigations, Kennedy replied, his voice less steady than before. However, CMS takes all allegations of fraud very seriously and works closely with appropriate law enforcement agencies when issues arise. AOC consulted her notes, clearly prepared for this deflection. Secretary Kennedy, I'm not asking you to comment on investigations. I'm asking whether you're aware of them. Are you aware that United Healthcare, which receives billions in Medicare Advantage payments, is under DOJ investigation for systematically inflating risk scores to increase government payments? Kennedy's discomfort was now visible to everyone in the room. He reached for his water glass, buying time while formulating a response. Congresswoman, as I mentioned, I cannot discuss specific investigations or companies in this setting. Let me ask a different question then. AOC continued, her tone becoming more prosecutorial. Are you familiar with the Inspector General's reports from 2021, 2022, and 2023 that documented systematic overpayments in Medicare Advantage plans due to inflated risk scores? This question struck closer to home because Kennedy could not claim ignorance of publicly available Inspector General reports. Yes, Congresswoman, I'm familiar with the IG's work on payment accuracy in Medicare Advantage. And yet, despite 3 years of Inspector General reports documenting billions in overpayments due to fraud and abuse, your department is proposing to increase payments to these same companies by $25 billion. Can you explain that contradiction? The question hung in the air like an accusation. Kennedy found himself in an impossible position. Acknowledging the problems would undermine his department's policy decisions, while denying them would contradict publicly available government reports. Congresswoman, payment updates are based on comprehensive actuarial analysis that considers multiple factors including medical cost trends, administrative costs, and quality incentives. Kennedy responded, falling back on technical language that obscured rather than illuminated. AOC was not satisfied with bureaucratic evasion. Secretary Kennedy, I have here a document from your own department's Office of the Actuary. She held up a thick report. This document shows that Medicare Advantage plans cost taxpayers approximately 15% more than traditional Medicare for equivalent populations. If these plans are more expensive and plagued by fraud, why are we increasing payments? Kennedy's prepared talking points were useless against AOC's specific documentation. Congresswoman, Medicare Advantage provides additional benefits and services that beneficiaries value, including prescription drug coverage, dental care, and wellness programs. Secretary Kennedy, those additional benefits cost approximately $2,000 per beneficiary per year. The overpayments due to inflated risk scores average $3,200 per beneficiary per year. Are you telling this committee that we're paying insurance companies $3,200 extra to provide $2,000 in additional benefits? The mathematics of AOC's question were devastating. Kennedy realized he was being systematically cornered by someone who had done extensive preparation and understood the technical details better than most congressional members. Congresswoman, those figures require context and— Secretary Kennedy, AOC interrupted. My time is limited, so let me ask directly. Do you believe it's appropriate to increase payments to insurance companies that are under investigation for defrauding taxpayers? Kennedy's face flushed as he struggled to formulate a response that wouldn't be politically damaging. Congresswoman, Medicare Advantage serves millions of Americans effectively, and payment policies are designed to ensure continued access to care. That's not what I asked, AOC pressed. I asked whether you think it's appropriate to reward companies under investigation for fraud with $25 billion in increased taxpayer funding. Yes or no? The silence that followed lasted nearly 30 seconds, an eternity in congressional hearing time. Kennedy appeared to be calculating the political ramifications of any answer he might give. Committee members leaned forward, recognizing that they were witnessing something unusual. Congresswoman, Kennedy finally responded, fraud allegations are taken seriously, and when substantiated, appropriate actions are taken. However, policy decisions must be based on the needs of beneficiaries and the overall functioning of the program. AOC's expression showed she recognized Kennedy's non-answer for what it was, but then she revealed the ace she had been holding. Secretary Kennedy, since you seem reluctant to address these issues directly, let me share some additional information. AOC pulled out a manila folder. 3 days ago, my office received a comprehensive report from Dr. James Martinez, a former CMS actuary who worked directly on Medicare Advantage payment calculations. Dr. Martinez has provided detailed documentation showing that your department has been aware of systematic fraud patterns for over 2 years but chose not to act. Kennedy's face went pale. This was information his team hadn't prepared for. According to Dr. Martinez's analysis, AOC continued, the overpayments aren't accidental billing errors. They're the result of deliberate policy decisions that prioritize insurance company profits over taxpayer protection. Would you like to explain why your department chose to ignore $50 billion in documented fraud? Before Kennedy could respond, AOC produced another document. I also have here signed affidavits from 12 Medicare Advantage employees who describe systematic pressure to inflate diagnosis codes and manipulate risk scores. These whistleblowers have provided evidence that fraud isn't an exception in Medicare Advantage. It's the business model. The hearing room erupted in whispers and shuffling papers. Kennedy's carefully constructed facade was crumbling in real time. Congresswoman, I would need to review any such allegations carefully. Secretary Kennedy, AOC interrupted with newfound authority, you've had 2 years to review these issues. The evidence is overwhelming, the fraud is documented, and you're asking taxpayers to reward it with $25 billion in additional payments. That ends today. AOC then delivered the knockout blow. Mr. Chairman, based on the evidence presented today, I am formally requesting that this committee vote to freeze all proposed Medicare Advantage payment increases pending a full DOJ investigation into systematic fraud within the program. I am also requesting that Secretary Kennedy be relieved of his oversight responsibilities for Medicare programs until this investigation is complete. The room fell completely silent. Never in recent memory had a junior member of Congress essentially called for a cabinet-level official's removal during a hearing. But AOC's methodical presentation of evidence and Kennedy's inability to provide adequate responses had created an undeniable case for action. Chairman Bradley, recognizing the gravity of the moment, announced an immediate recess to consider AOC's motions. When the hearing resumed 30 minutes later, the political landscape had shifted dramatically. Tell us in the comments. Are you watching from your living room, your lunch break, or maybe while commuting? We want to know where our viewers are tuning in from around the country and what you think about AOC's bold move to freeze Medicare payments and demand Kennedy's removal. The committee voted along party lines to freeze the Medicare Advantage payment increases pending investigation, with 2 moderate Republicans joining Democrats to support the measure. More significantly, the committee voted to refer Kennedy's conduct to the House Ethics Committee for failing to properly oversee Medicare programs. Within hours of the hearing's conclusion, the story dominated every major news outlet. Unlike typical congressional hearings that generated brief coverage, AOC's systematic demolition of Kennedy and presentation of whistleblower evidence created a story that transcended partisan politics. Even conservative media outlets struggled to defend a system that was clearly defrauding taxpayers. The immediate impact was swift and decisive. United Healthcare's stock price plummeted 8% in after-hours trading as investors recognized that serious regulatory scrutiny was now inevitable. Other Medicare Advantage insurers saw similar declines as the entire industry faced the prospect of payment reforms and fraud investigations. Dr. Martinez, the former CMS actuary who had provided AOC with crucial evidence, was immediately granted whistleblower protection and began cooperating with an expanded DOJ investigation. His detailed knowledge of Medicare Advantage payment mechanisms provided investigators with roadmaps for prosecuting fraud cases that had previously seemed too complex to pursue. 3 weeks after the hearing, Secretary Kennedy announced his resignation, citing personal reasons but clearly responding to political pressure that had become insurmountable. His departure marked the first time a senior healthcare official had been forced from office due to congressional oversight in over a decade. More importantly, AOC's efforts led to concrete policy changes. The Centers for Medicare and Medicaid Services announced new oversight mechanisms for Medicare Advantage plans, including real-time monitoring of risk score inflation and mandatory reporting of diagnosis coding patterns. Insurance companies would face automatic audits if their risk scores increased beyond statistically normal ranges. The Medicare Advantage payment freeze that AOC had demanded was extended for 6 months while investigators examined billing practices across the industry. Early results suggested that the program had been systematically overcharging taxpayers by approximately $15 to $20 billion annually, money that could fund significant expansions of healthcare coverage for uninsured Americans. AOC's victory resonated far beyond Medicare policy. Her systematic approach to congressional oversight, combining thorough investigation, whistleblower protection, and strategic revelation of evidence, became a model for effective legislative branch accountability. Other progressive members of Congress began adopting similar investigative techniques for examining corporate fraud in various sectors. The hearing also demonstrated the power of individual legislators to create significant policy changes when they combined preparation with courage. AOC had shown that a junior member of Congress could take on entrenched interests and win, inspiring a new generation of activists and politicians who had previously felt powerless against corporate influence in Washington. For millions of Americans struggling with healthcare costs, AOC's confrontation with Kennedy provided vindication that someone in Washington understood their concerns and was willing to fight powerful interests on their behalf. The Medicare fraud she exposed represented money that could have reduced premiums, expanded coverage, or improved benefits for ordinary citizens. The long-term impact extended beyond immediate policy victories. AOC's success in exposing Medicare fraud and forcing accountability created momentum for broader healthcare reforms. Public awareness of insurance industry practices increased dramatically, generating pressure for additional oversight and regulation across the healthcare sector. 6 months later, the DOJ announced the largest Medicare fraud prosecution in history, charging executives from 3 major insurance companies with systematically defrauding taxpayers of over $2 billion annually. The evidence that AOC had revealed during her confrontation with Kennedy provided the foundation for these criminal cases. The story became a case study in effective democratic accountability, showing how individual representatives could make significant differences when they combined careful investigation with strategic communication and unwavering commitment to public interest over political convenience. AOC's victory also highlighted the importance of whistleblower protection and investigative journalism in exposing government failures. The former CMS employees who provided crucial evidence faced retaliation attempts from industry allies, but AOC's advocacy helped secure legal protections that encouraged other government workers to report wrongdoing. The Medicare Advantage reforms ultimately saved taxpayers an estimated $12 billion annually while maintaining healthcare access for beneficiaries who chose to remain in private plans. The fraud detection mechanisms that AOC's efforts had prompted prevented billions in additional overpayments and created deterrent effects that reduced systematic billing manipulation across the industry. Most significantly, AOC had proven that corruption and fraud could be defeated when representatives prioritized constituents over corporate interests. Her willingness to challenge Kennedy directly, demand concrete answers, and follow through with policy solutions demonstrated that individual courage could overcome institutional inertia. The hearing marked a turning point in AOC's political career, establishing her as a legislator capable of achieving concrete victories rather than merely generating headlines. Her combination of progressive values with effective oversight skills made her a powerful force for accountability that corporate interests could no longer dismiss or ignore. For ordinary Americans watching the confrontation unfold, AOC's victory provided hope that democracy could still function effectively when representatives had the courage to challenge powerful interests. Her systematic dismantling of Kennedy's defenses and successful demand for policy changes showed that David could still defeat Goliath in Washington. The lesson was clear. Prepared, persistent, and principled representatives could still make significant differences in protecting taxpayer interests and ensuring government accountability. AOC had not only exposed massive fraud, but had successfully demanded and achieved concrete reforms that would prevent similar abuses in the future. Her triumph over Kennedy became more than just a congressional hearing. It became proof that justice could prevail when representatives refused to accept bureaucratic evasion and corporate fraud as inevitable features of American governance. Click subscribe to catch future moments when justice triumphs over corruption in Washington's corridors. Thank you for watching, and we'll see you in our next video. God bless you, and God bless America.